We hope you are all doing well. It gives me great pleasure to welcome you all to the Abu Dhabi International Mental Health Virtual Conference 2020. Before we proceed with the session, let us listen first to a few verses from the Holy Quran.
بسم الله الرحمن الرحيم إنا فتحنا لك فتحا مبينا ليغفر لك الله ما تقدم من ذنبك وما تأخر ويتم نعمته عليك ويهديك صراطا مستقيما وينصرك الله نصرا عزيزا هو الذي أنزل السكينة في قلوب المؤمنين ليزدادوا إيمانا مع إيمانهم ولله جنود السماوات والأرض وكان الله عليما حكيما. بسم الله الرحمن الرحيم بسم الله الرحمن الرحيم إنا فتحنا لك فتحا مبينا ليغفر لك الله ما تقدم من ذنبك وما تأخر ويتم نعمته عليك ويهديك صراطا مستقيما وينصرك الله نصرا عزيزا هو الذي أنزل السكينة في قلوب المؤمنين ليزدادوا.
Dear attendees, presenters, organizing committee and distinguished guests. It's indeed my great honor to warmly welcome you all to Abu Dhabi International Mental Health Conference 2020 and sincerely thank you for all commitments and efforts made at the meeting. While we regret that COVID pandemic prevented us from holding the conference in the beautiful city of Abu Dhabi, we are excited about the opportunities of holding an innovative virtual conference. Holding the conference virtually will be a great opportunity for using digital and social media during the pandemic to reach a wide audience across the world. The conference will stimulate mental health workers around the world to present innovative and culturally significant research and clinical innovations in mental health and early intervention. The promotion of mental health is not for specialists but for everyone in the community, including people with lived experience, clinicians, educators, family members, scientists, and industry. Reaching new frontiers require fresh vision and novel strategies. producing the conference online fits perfectly with these aims, as it will allow us to reach a wider audience than a traditional conference can possibly include. Since the first confirmed COVID-19 case reported in China in December 2019, the number of confirmed COVID-19 cases has been increasing rapidly in most countries of the world. And the COVID-19 outbreak was characterized as a pandemic by the WHO in early March 2020. In addition to economic impacts and social disruptions, COVID-19 has also brought a massive impact on public mental health. As we tend to end 2020, one has to look no farther than the daily news reports to understand the continuing burden of mental health. Psychiatry is the principal branch of solution concentrated on the analysis, treatment, and anticipation of mental, passionate, and behavioral scatters. Psychiatry conferences offer a rostrum for thought agitation discussion on novel approaches of the eminent persons within the field. I am delighted that the organization and scientific committees have obtained tremendous support from our speakers, presenters, and sponsors, thus enabling us to successfully convert the Congress to a virtual one. Our scientific program includes keynotes given by internationally recognized speakers, as well as 100 symposium sessions, poster presentations, and workshops. We have eminent presenters from Maudsley Health Institute UK, World Association of Psychosocial Rehabilitation Spain, Psychiatric Rehabilitation Association USA, Child and Family Training UK, Ain Shams University Egypt, Saudi Psychiatric Association, Egyptian Association for Behavioral and Cognitive Therapies, UAE Genetic Diseases, and UAE Ministry of Health and Prevention. I am sure this conference would be an exciting and illuminating one for all. The conference represents an opportunity to inspire the world with a perspective of hope in prevention research, in therapy, in service organization, in mental health. We are certain all of you will find the conference stimulating, rewarding, and meaningful. Once again, on behalf of the organizing and scientific committees, welcome to Abu Dhabi International Mental Health Conference 2020. Thank you.
Thank you very much, Dr. Mohammed Al-Garhi. Now, to inaugurate the conference, may we call on Dr. Moza Mohammed Al-Sabusi, Consultant Psychiatrist, Head of Community Mental Health Services, Chair of Behavioral Sciences Institute at Al Ain Hospital.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good morning. Dear colleagues and friends, honorable guests, ladies and gentlemen, it is a moment of pride and pleasure for me to welcome you all to the 5th Abu Dhabi International Mental Health Congress on Mental Health and COVID-19 in partnership with the 5th Annual Maudsley Health Conference, taking place virtually in the period between the 12th and 14th of November 2020 in Abu Dhabi. While we are not able to reunite together in person this time due to the global COVID-19 pandemic, we are proud to organize an innovative learning experience alternative to the traditional in-person conference. This year's program offers the same exceptional learning experience as the physical conference with world-class speakers, high-quality content, and new networking opportunities in a truly unique and dynamic environment full of innovation. I would like to express my heartiest gratitude to all members of scientific and organizing team, speakers, delegates, and sponsors for their time, efforts, and contributions in making the 5th Abu Dhabi International Mental Health Congress as one of most premier scientific events in the entire region. As we work together to map out our future plans, I'm sure that the recommendations you may conclude during this conference will make a true difference. It is in the enlightened self-interest of us all to enhance the personal and professional relationships among mental health care professionals from different countries. Thank you for your participation, and I wish you a very productive conference and enjoyable learning experience.
Thank you very much, Dr. Moza Mohammed Al-Sabusi. Joining us also today to give us the welcoming remarks is Sir Norman Lamb, Chairman of South London and Maudsley NHS Foundation Trust.
Dear friends, colleagues, ladies and gentlemen, over the last 4 years, I have enjoyed the pleasure of welcoming you to the Abu Dhabi Mental Health Conference as the chair of the event. However, this year is different. Today, I'm welcoming you as a guest of honor, and I would like to take this opportunity to bid farewell to all of you as I'm returning to my home country in a few days. With that said, I want to assure you that I'm leaving the event in the safe hands of my friend and colleague, Dr. Mohammed Al-Garhi, the best to take over, and ensure the continuous success of the conference over the years to come with the outstanding organizing capabilities of Dr. Midhat Al-Sabahi, who has continuously supported the conference. Together, they will bring a lot of added value while ensuring continuation of the great efforts leading the conference to more success. With a few days left for me here before I start my new chapter in Egypt, I would like to thank everyone who contributed to the success and development of the conference over the years. From the core organizing team to the speakers, the event organizers, and the media. It was a great pleasure to work with all of you, and I wish you all the success. Dear colleagues and friends, it was a long journey with many great memories. I am delighted today to take this opportunity to wish you all the happiness, health, and success. Now, I bid you farewell with the hopes that we stay connected over the years. With that said, I hope you enjoy the conference for this year, and goodbye.
Thank you very much, Dr. Tariq Abdullah Darwish, our guest of honor and consultant psychiatrist, Sheikh Khalifa Medical City, Abu Dhabi, UAE. Let's hear now from Dr. Sir Norman Lamb, the chairman of South London and Maudsley NHS Foundation Trust.
Hello, I am Sir Norman Lamb and I'm the chair of the South London and Maudsley NHS Foundation Trust. I'm also the chair of the Children and Young People's Mental Health Coalition in England. And up until last December, I was a member of the UK Parliament. I'd been there for over 18 years. And between 2012 and 2015, I was the minister in the UK government responsible for mental health. And I saw that as an enormous opportunity. I have a passion for mental health, I suppose informed by our own family experience of mental health. Our oldest son was diagnosed with obsessive compulsive disorder as a teenager. And I also tragically lost my oldest sister to suicide just a few years ago. And so I was determined as minister to use the opportunity to advance the cause of mental health and to ensure that it was treated equally with physical health within our National Health Service. Now at the Maudsley, I continue my interest and in particular my focus on how we can do better on prevention of mental ill health. And so I was delighted, incidentally, to see that the name of the ministry is the Ministry of Health and Prevention, absolutely right to prioritise a focus on prevention. But I'm interested also in how we can intervene earlier to prevent a deterioration of health and how we can support people more effectively in the community so that we can avoid, where possible, the need for inpatient treatment. And I think in all these ways, we have a great alignment with some of the priorities that you are focusing on in the UAE. And I'll come back to that in a little while. So it is with enormous pleasure that Maudsley Health was invited to deliver this joint conference with the Abu Dhabi International Mental Health Conference. It's a pleasure and an honour to do so. And it's great to collaborate, to work together. And in particular, we value working closely with Dr. Medhat Al-Sabahi from CIHA, the conference director. Our whole approach is partnership working. That's the way in which we achieve improvements for mental health. Now, this is the 5th annual Maudsley Health Conference, the first two in Abu Dhabi, then in Dubai in conjunction with the Ministry of Health and Prevention, and one at the Al Amal Psychiatric Hospital. I really look forward to being able to visit the Al Amal Psychiatric Hospital. I've heard great things about it. I rather envy the wonderful facilities that you have there. And as soon as we're able to travel, that may well be possible. So I'm thrilled that the Ministry of Health and Prevention has identified mental health as a priority. This is so important. And I'm aware that the region as a whole is prioritising mental health. And I know that mental health law is being updated. This is also really important. And I know there's a lot of work underway in both Dubai and Abu Dhabi to broaden the range of mental health services that are offered. And I really applaud this enlightened approach. And there may well be opportunities for us to offer support and help and training as you go on your journey. And I think there will also be research opportunities as well. I'd like to emphasise how pleased we are to be operating in the UAE and to do it with the support of Makani. And I'd like to mention in particular our long-standing and strong relationship with Mr. Shafkat Malik. He has always emphasised the importance of delivering quality mental health services. That ethos fits so well with the Maudsley and makes us feel that we can continue to work so well together. And I wanted to mention our world-leading research institute, the Institute of Psychiatry, Psychology and Neuroscience. And our interest is how we can translate world-leading research into practice for the benefit of the patients who use our services. And we're also part of King's Health Partners, a really strong academic health science centre. Now we're focused, as I say, on that translation of research into practice. So we're really pleased to bring all of our experience and our know-how from the UK, but together also with everything that we've learned in our 5 years in the region to help you in your journey to improve mental health care, a journey that we are all on together. And if we do it together, we will succeed more effectively. Now, I'm struck by how our priorities at the Maudsley and the priorities in the UAE align so well. The intensifying focus on well-being. Because if we think about it, surely what we should all be about is how we enable people to lead a good life, a happy life, a life with well-being. How we improve our effectiveness at preventing ill health, as I described at the start, and how we improve community services so that we can avoid the need for inpatient admission where possible. Now, also at the Maudsley, we have real expertise in some approaches which have been traditionally focused in inpatient care, but where we can actually do so much in the community. And I give as an example of that eating disorder services, which at the Maudsley now are internationally recognised. How we have learned the effectiveness of intervening early to prevent a deterioration of health. So I'm really pleased that we're setting up the Maudsley Multidisciplinary Eating Disorder Service in the UAE. And Dr. Victoria Mountfield and Dr. Taizim Danji will be presenting later in the day. And Maudsley is also leading on implementing children's eating disorder services in the UK, supporting young people in the community, preventing the disruption of inpatient admission where possible. And I remember when I was minister visiting the Maudsley to see this deeply impressive service, which is making a difference to so many families' lives. So I will be handing over soon to Professor Ahmed Akasha for the Honorary President's address on the impact of COVID on mental health, because it is clear to everyone, I think, that there will be a significant psychological fallout from the COVID pandemic. Also looking forward to hearing Sir Simon Wesley, Professor Sir Simon Wesley, I should say, who will be delivering the keynote today on mental health care for mental health care workers, those people who have gone through enormous challenges through this COVID pandemic. And I know that he has real expertise in this area. And on Saturday, the keynote will be given by Professor Alan Young on psychiatry in the time of COVID. And there will also be contributions from others at Maudsley and King's and Maudsley Health in the UAE, as well as other respected colleagues from the region and further afield. And finally, I would just like to repeat, I'm just really looking forward to visiting you and to meeting up with you when we're able to travel again. And I hope you have a really good conference. Thank you very much indeed.
Thank you very much, Sir Norman Lamb. And now it gives me the pleasure to introduce Dr. Midhat El-Sabahi, Conference Director and Head of Psychiatric Rehabilitation Division, Head of the Scientific Sections of Arab Federation of Psychiatrists, Head of Psychiatric Rehabilitation Department at SKMC. Welcome to our Honorary President for his welcome speech and lecture presentation.
Good morning. Assalamu alaikum. It's my pleasure to see you once again in our conference, or actually in your conference. This conference, you made the success of this conference by your participation and your regular attendance and support to us. This year we're having the virtual platform because we don't want to be away from you long because of the COVID-19 issues. We got more than 2,500 registration till yesterday, and also today, and at the moment more than 1,300 are logged in attending the opening ceremony. It's our pleasure that we always have such a wonderful attendees and delegates like you supporting us and making everything enriched with your knowledge and your interaction. I'm really sorry that we have a very busy program for 3 days, 3 tracks, and we have more than 100 presentations and more than 100 speakers. But my own pleasure is always to introduce my dearest professor, the professor of all professors, as I used to name him, and he's also named the Sultan of Psychiatry. Professor Dr. Ahmed Akasha is one of the most important psychiatrists in the world. He was the president of the WPA, World Psychiatric Association, and he founded the psychiatry, Ain Shamsian Institute of Psychiatry, Akasha Institute of Psychiatry. This institute actually is a collaborating center for training with the WHO and WPA, and accredited as a training center as well for WAPR, World Association for Psychosocial Rehabilitation. Dr. Akasha is a professor of all of us. He has lots of efforts expanding the psychiatric knowledge and education all over the world. And he's the lead psychiatrist in the Arab world. And whenever you mention Dr. Ahmed Akasha, you need to speak about the first thing done. So he's the honorary president of the Arab Federation of Psychiatrists. He's honorary president of the Egyptian Psychiatric Association. He is leading all of us in the education and supporting all of us. I'm really honored to introduce my dearest professor, Professor Ahmed Akasha, and please welcome with me Professor Ahmed Akasha. Thank you very much. Have a good day.
Good morning, ladies, gentlemen, colleagues, friends, sons, and daughters. I'm very honored and pleased to speak in the conference about the problem of COVID 19 on mental health, whether during the infection or following the infection after recovery. As you know, that there is increased risk of COVID infection and mortality in people with mental disorders. And all this lecture will be going around this topic. Currently, all of you know that we have a global pandemic with more than 40 million. Actually, I read yesterday that it reached 41 million cases and more than 1,100,000 deaths worldwide. The problem, the association between the infection, COVID 19, and the socio-economic deprivation, which happens in old age and also in association with several medical conditions which increases the risk. But persons with pre-existing mental disorders may represent a population with increased risk of COVID-19, where the outcomes of infection are usually worse. We have a certain type of vulnerable population which may be affected by COVID 19. And even the related mortality, especially in women who have more vulnerability to the socio-economic and the emotional effects of the infection. Again, living in crowded places, crowded hospitals, crowded residences, in prisons, where the environment of these places, infection can disseminate very rapidly. Homelessness and unstable housing may affect their ability to quarantine. Not only this, but the stigma result in barriers to access of health. People are afraid to speak about it, are afraid to say they are sick, because now, unfortunately, that the word COVID disease or COVID 19 have become a stigma, and people are reluctant to seek treatment because of this stigma. This has to be removed completely. We have patients that specific manifestations of the individual mental disorders may influence the risk differently. For example, patients with ADHD, their inattention might place them at a higher risk for forgetting to wear the face masks or maintaining social distancing. Again, those with depression, the motivation might lead them to neglect protecting themselves or seeking medical attention when indicated. Patients with schizophrenia, the delusional thinking might lead a real problem to the patient to reject the use of a face mask. Also, as you know, mental disorders usually are associated with higher risk for taking drugs. And so, if we take tobacco smoking, highly prevalent to patients with schizophrenia, bipolar disorder, depression, compared to the general population. Patients with mental disorders who are smokers smoke more heavily than those who don't have a mental disorder, which accentuates the risk for pulmonary pathology, making them more vulnerable to severe COVID-19 disease. Just to know that so many surveys have shown that 70 to 80% of people with schizophrenia, they smoke, apart from other, of course, psychiatric disorders. Uh, all analysis showed that medical comorbidities, cancer, cardiovascular, obesity, chronic kidney diseases, asthma, chronic obstructive pulmonary disease, diabetes, substance use disorders, they contribute to the higher COVID-19 infection in patients with a recent mental disorder. There is some example which has been proved to be true, a common biological factor that contributes to various mental disorders and also to COVID-19 pathology, which is inflammation, which is reported that it plays a role in the pathogenesis of depression, schizophrenia, bipolar disorder, as well as the systemic manifestations of COVID. If we look at patients with COVID-19 infection and the recent diagnosis of mental disorder, have an increased risk of death 8.5% versus 5.7%. Even the difference in death rates of COVID-19 compared to COVID patients who have no mental disorder, the difference is quite high. It is 48% higher in magnitude and recently reported for COVID-19 patients with substance use disorder, 45% higher than those who don't have a mental disorder. There is some aspects of the not only psychiatric or mental disorder, the neuropsychiatric morbidity الأمراض المرضية في الأمراض النفسية والعصبية. There is a high level of psychological distress and morbidity in healthcare workers, especially those healthcare and other workers working in frontline or first responders related to apprehension and living difficulties. And we shall mention later on that the suffering and the death rates of health workers have reached quite a percentage among all people or death rate in corona and COVID. We have evidence that there is a neuropsychiatric morbidity during infection. That's the delirium. And also, later on, there are so many risks of mental disorders. Another group are those who are living under quarantine and they are suspects that they may develop the disease and they are in great panic and fear and anxiety. The fourth group, those who are near the dear ones who have died due to infection, that we cannot grieve them due to barriers and restrictions even after death. There is a neglected group already with pre-existing mental disorders, especially with severe mental illnesses. Finally, which is the largest group, are persons from the general population who belong to neither of other groups above and who are living under the shadow of the pandemic, especially those experiencing the isolation of a stringent lockdown or its severe complications or repercussions. We have a problem about what's called social distancing because some people believe that it's not only social, it's a physical distancing. Uh, Two very distinct contexts in this perspective. And some people believe that it is a misnomer, it should be physical distancing. التباعد الاجتماعي وليس التباعد لوحده الاجتماعي، also التباعد الجسدي. We have to define that these social concomitants of the isolation of people, the locked-in patients, they have a lot of symptoms that we shall discuss later on. Depression, demoralization. على فكرة demoralization in Arabic means انحطاط الروح المعنوية أو انخفاض الروح المعنوية. Anxiety of is also various sorts, whether it's anxiety, whether it's panic, whether it's OCD, whether it is phobias, and so on. Sleep disorders, substance misuse, and exacerbation of the previous disorders that they may have. In rare cases, suicides or suicidal attempts have been reported. So there are obvious repercussions of social distancing and hence constitute the downstream effects. Domestic or other interpersonal abuse or violence is another documented serious fallout of these measures because life was created that the husband, wife, and children they don't stay together for 24 hours for long days or long weeks. Usually, the husband and wife meet each other 3 or 4 hours a day, and this is since the Stone Age when they used to go to find the animals that they will eat or they will feed and so on, and they comes late at night, they feed, and on sunset they go to sleep, and on the sun sets. Yes. So actually, this has created a lot of friction, and, which made a lot of side effects, as I mentioned before. There are so many disadvantages group related to artificial boundaries in world regions, country, economy, class, color, race, ethnicity, gender, age, language, history, culture, work, healthcare systems, and so on. So we have a poor person who lacks the money or the insurance to pay for treatment. A migrant laborer working in unsecured informal sector starts reverse immigration, walking thousands of miles after losing a day paid job. Some people stigmatized belonging to a country which is abused simply because of one's country of origin, and so on. The social media is a double-edged sword. It can be a tremendous benefit in quick and widespread of useful and factual information, but again, it can be destructive equally rapidly and efficiently, and widely disseminated in half facts, non facts, plain lies, loads of misinformation, miracle treatments, doomsday prophecies, and so on. And the messages peddled in social media often serve gossips other than pure science and data. More worryingly, these can be increase anxiety and even disseminate racial hatred. The WHO recommended that you shouldn't go on opening all the social media to know the news about the COVID-19. If you want to watch it twice daily, maximally, for 3 or 4 minutes, and then should watch anything else because you are increasing your panic and anxiety of focusing that life is COVID-19, although life has so many things other than COVID-19. It's very important that social psychiatry here becomes relevant for this pandemic and related groups of factors, which is called now social concomitants and social infection. Uh, Now that we have this social concomitants, a nurse who goes to her apartment after 12 hours duty and how she is treated by not letting her uh, joining the others because they are afraid that she may transmit the infection to them. The same thing with doctors or frontline care workers for similar reasons. It's very difficult for any human being of not letting the family bury their dead, keeping a distance away from your gardener because he comes from a particular class, discrimination, xenophobia, stigma, you name it. Again, it's very interesting to know that there are very broad clinical syndromes associated with COVID 19, like acute ischemic, hemorrhagic, or thrombotic vascular events involving brain parenchyma or subarachnoid space, altered mental states, acute alteration in personality, behavior, cognition, or consciousness, even peripheral neurology, and you shall see later, peripheral nerves, neuromuscular junction, and so on. The neurological complications are many, and they increase the area of morbidity and mortality. It has been recorded so many acute cerebrovascular events like encephalitis, Guillain-Barré syndrome, acute necrotizing hemorrhagic encephalopathy, meningoencephalitis, and strokes may occur. The problem that sometimes the patient has psychotic symptoms from the infection itself or after the infection, and at the same time, he has some brain complications like encephalitis or encephalomyelitis. And here we're not sure whether this is actually encephalitis or a psychotic behavior from the disease itself. So we have to take this into consideration. These are the some neuropsychiatric symptoms which occur during the acute infection. And you can see the pathogen in front of you. Insomnia, attention concentration, anxiety, memory impairments, depressed moods, confusion, and altered consciousness. This is again a very important aspect. The cognitive impairment emerging as a common sequel in COVID 19. Discharged from ICU and we can expect an increase in referrals to the memory clinics in the short or medium term. So many people they start to be forgetful and they don't have the same concentration as before, and actually it's a cognitive impairment. And this may be secondary to the infection and it may occur during the illness or after the illness, and it may stay for a few months or a few weeks. This is just a summary. I'm not going to go into the details, I have mentioned them, but it's very interesting that at the beginning of anosmia that the hearing, not the hearing, the taste and the taste and the olfaction smell will be affected, but recently also that hearing can be affected, apart from all the peripheral nervous system and central nervous system symptoms. We have a messages, just a summary, وسائل للجميع for the general population. We should be empathetic to all those who are affected. They haven't done any wrong to be infected. We don't treat them as a real danger to us. And don't refer that he's a patient who has COVID or they are victims or this is COVID families or diseased. It produces a stigma It is just that we in psychiatry, we don't want to say a schizophrenic patient, somebody who is suffering from schizophrenia, somebody who is suffering from bipolar. But we are not going to extrapolate this individual to a disease. What about other aspects of the personality? And please protect yourself and be supportive to others and assist others in times of needs. Check by telephone, check by neighbors, by any sort of uh, mass media, and so on. Healthcare workers may unfortunately experience avoidance by their family or community owing to stigma or fear. This is a very challenging situation, very painful after all the effort they are doing. So be careful and turn to your colleagues, your manager, and other trusted persons for social support. Many or manage urgent mental health and neurological complaints, delirium, psychosis, severe anxiety or depression with emergency or general health care. That's to say, it's better to have a group of psychiatrists staying with patients and with health carers in the hospitals, giving support, whether psychotherapy support or medical support. We had a problem in Egypt that so many hospitals did not agree to accept patients who have mental disorders with corona or COVID disease because if they are admitted to a unit and they are very expensive apparatuses and machines and they may be violent and they destroy it, it will cost millions of pounds lost because of this violence. And so I approached the ministers of health in Egypt. I told her, you have to do something. And actually, probably, I don't know whether there are other countries which have done it or not, but we have a special hospital and a very good hospital allocated in the middle of Cairo. And this is especially for patients who are mentally disordered and developed the coronavirus, COVID. This has removed a lot of stigma and a lot of things about these patients who are suffering and nobody would like to help. And mind you, there hasn't been a case of violence because of the psychiatrist treating them for all these patients who were admitted in the last few months in these intensive care units and so on. Also, we have to have careful children who are suffering from COVID. We have to give them support. We have to express our emotions. We have to have a creative activity with them. We have to feel that they can be relieved and they can communicate even by teleconference or even by helping them by being close to them as much as possible with distancing and so on. Regular contacts with parents are very important in increasing support for children. And older people don't think that a demented patient is unaware of everything. He can suffer and he needs only simple facts so that he can understand what's going around. He may not know the sequences, but at least he needs some support in some way or another. There is a very good article with the person who was elected, Danuta Wasserman, the chairman of the Suicidology International Suicidology. She was elected as president of the World Psychiatric Association, and she wrote that this summary in this slide that we know that suicide is among people about 800,000 or reaching a million. And people who die from suicide are more than those die from accidents or die from even wars. and hunger and so on. During times of crisis, suicide rates may momentarily decrease, but when the immediate crisis has passed, suicide rates increase. Suicide occurs with an imbalance of risk and protective factors on an individual, or relationship, or community, and society levels takes place. It is after the COVID that we are afraid, and so we should do all the precautions of evidence-based suicide preventive methods should be strengthened. Social loss and job loss. That recent data showed that higher shares of people who are sheltering in a place, 47%, reported negative mental health effect resulting from worry or stress related to coronavirus than among those who are not sheltered in a place. Negative mental health effects due to social isolation may be pronounced among older adults, households, and adolescents who are already at risk of depression and suicidal ideation. Job loss is associated with increased depression, anxiety, distress, and low self esteem, and may lead to higher rates, more than half of the substance use disorders and suicide. There is also burnout and strain among front healthcare workers, and we have mentioned this before that I don't know, but so many people, WHO says that at least 10% of the deaths are among the people who are caring for the COVID are from the health workers, whether doctors or nurses, which is quite high. And now there's a plea that these people are young and they may be married, they have children, and should be treated as martyrs, like in any war or anything, because they are really functioning in a very, very morbid state regarding the shifts, regarding the stigma, regarding the possibility of death at any time. So I think their families should be treated this way. This is something away, but this is the enzyme which is related to COVID. This is the key to entry of the virus inside the body. The virus may take another synaptic route via the olfactory bulb upon inhalation without using the ECE2 receptors. There is something called septic shock. Depends on the severity of the infection. It enters the respiratory tract, as I mentioned before, through the angiotensin converting enzyme, and it induces sepsis or septic shock. يسموها بالعربي الصدمة الإنتانية. The respiratory manifestations اللي هي severe dyspnea, hypoxia, is the basis for the grading of mild, moderate, and severe. There is also something called aciphotis cytokine. Cytokine is called storm and coagulation. Coagulopathy is associated with COVID-19. And now this coagulopathy can occur in any organ in the body, producing a lot of things. And this is through the cytokine profile, especially the interleukin 6. The reason for this life-threatening condition is not known, but it is driven, look at this word, uncontrolled hyper-inflammatory response to a novel pathogen without previous immunity. This will cause a cytokine storm, and in this case, the inflammation will increase, and there will be even shut in all organs in the body, and this can produce death, as you know. So Coagulation disorders in coronavirus very important to understand, and it occur in all organs, and this is the cause of death, whether it is pulmonary clots, heart clots, brain functions, kidney, whatever. And they say that the interleukin 6 in the pathogenesis of COVID 19 has an important role, and there are some bases and some studies working to produce something which can be either a drug for therapy or a vaccine for helping patients suffering from this. There are two things I would like to say, which is a bit laughable, but this happens. There's something called cottage syndrome, متلازمة الكوخ. Home isolation to stop propagation of COVID is beneficial, but induced psychiatric disorders because of being locked in home have been occurring to a great extent. It's considered one of the psychiatric disorders resulting from social and home isolation. For instance, in Italian Psychiatric Association said that more than 200 million Italians suffered from this disorder, and they may suffer from PTSD after passing through a traumatic experience, not only because of fire, murder, rape, or terrible accident, but a sudden change in the pattern of style of daily routine. Go work, come and stay home. She goes work, come stay at home, see the children and so on. But to stay 24 hours with the children and the partner or the spouse, this may create a lot of friction and discovery of some sort of disharmony of thoughts and so on and so on. The symptoms fatigue, lassitude, grief, or sadness, depression, lack of concentration, irritability and anxiety, insomnia, or somnolence, increased appetite, and they may not have all these symptoms, but all of them will have irritability and continuous anxiety. How to overcome cottage syndrome? It's not by drugs. Sunlight exposure, if you have breakfast in the balcony, if you don't have garden. Food that improves mood like almonds, pistachio, cashew, hazelnuts, dark chocolate, fish, and stay away from delivery foods and sweets. Use your brain by new ways to occupy your leisure time. Sports by allocating room to practice any type of sports. There is another one which is the same as the cottage syndrome, which is the cabin fever, distressing claustrophobic irritability or restlessness experienced when a person or group is stuck at an isolated location or in confined quarters for an extended period of time, isolated in a vacation cottage on the countryside, long periods underwater in a submarine, or being otherwise isolated from civilization. The cruise ship Diamond Prince, which with 600 passengers, they had with 600 COVID cases among 3,700 aboard, stayed 3 months in the ship. They cannot move, they cannot go anywhere. And the person here may have sleepiness or sleeplessness, distrust of anyone, paranoid symptoms, urge to go outside even in the adverse conditions, such as poor weather or limited visibility. And he reacts in a very different way from his normal state. He may take irrational decisions that could potentially threaten his life and others. Of course, the simple way of therapy for cabin fever is a simple getting out and interacting with nature directly. At last, the pandemic is likely to have both long and short term implications for mental health and substance use. Limited access of mental health care and substance use treatment is in part due to a current shortage of mental health professionals, even with telemedicine. Some mental health providers are increasing their use of telemedicine in the light of social distancing. Not all are able to do so because we don't have enough mental health professionals. The researchers are exploring novel approaches to treat the disease through targeting, as I mentioned before, IL-6 and its receptors based on prior experience of other disorders. Thank you for listening, and I hope a new vaccine will come soon, hopefully to have better news than what we have at the moment.
Yeah, thank you very much, Professor Akasha. As usual, very up-to-date knowledge and very interesting presentation. We are delighted that you are always supporting us, and we are happy that you are always with us, even in the virtual mood. And we hope next year, inshallah, we'll have you in person here in Abu Dhabi once again, being honored by your honorary presidency to our international conference. And now we are going to have a break, and we will be back at 11 to resume our three tracks modalities that we are going to have. So please be back at 11. Thank you very much, and have a good day. Thank you.